Henokh.
Good morning, everybody. Today on the news, I'm going to tell you about the coronavirus or the COVID-19. The coronavirus disease or the COVID-19 is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 will experience mild to moderate respiratory disease and recover without requiring any special treatments. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop with serious illness. The best way to prevent and to slow down the transmission is be well informed about the COVID-19, the disease, how it causes, and how it spreads. Protect yourself and others from the infection by washing your hands or using an alcohol-based rub frequently and not touching your face. The COVID-19 spreads primarily through droplets of saliva and discharge from nose when an infected person coughs or sneezes. So, it is important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow like this. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. The WHO will continue to provide updated information as soon as clinical findings become available. The COVID-19 affects different people with different ways. The COVID-19 is a respiratory disease, and most people infected with this disease will develop mild to moderate symptoms and recover without requiring special treatments. People with underlying medical conditions and those over 62 years old are more likely to develop with severe disease and death. Common symptoms include fever, tiredness, and dry cough. Other symptoms include shortness of breath, aches and pain, sore throat, and a few people will report diarrhea, nausea, or a runny nose. People with mild symptoms who are otherwise healthy should self-isolate and call their medical provider or a COVID-19 information line for advice on testing and referral. People with fever, cough, and difficulty breathing should call their doctor for a medical attention. The best way to prevent and to slow down the transmission of the COVID-19, do the following. Wash your hands regularly with soap and water or use a hand sanitizer. Maintain at least 1 meter between you and people coughing or sneezing. Avoid touching your face, cover your mouth and nose when you cough or sneeze. Refrain from smoking or others that weakens the lung. Stay at home if you feel unhealthy. And the last is practice physical distancing by avoiding unnecessary travel and keep away from large groups of people. Thank you.